Today on Wise Women Forward TV, we've got the noise of gardening outside our window. And women are telling Reddit things they are not apparently telling their doctors. Menopause may be moving your teeth. And scientists are working on a vaginal treatment that does not send estrogen on a full body field trip. So yes, a perfectly ordinary Tuesday. I'm Christopher Henze, and this is Wise Women Forward TV in the news. Why does menopause sound one way on Reddit and another way in the doctor's office? Researchers compared hundreds of menopause posts online with hundreds of clinical notes. On Reddit, women talked about anxiety, mood, memory, brain fog, and generally feeling like their operating system updated overnight without asking permission. In medical charts, the focus was more on hot flashes, night sweats, hormones, and treatment. Now, this does not prove that the doctors ignored the women. The researchers were not following the same people from Reddit into the examination room, but the difference is hard to miss. When women talk freely, the story gets bigger. When it enters the medical system, it gets edited. Maybe appointments are too short. Maybe some symptoms are difficult to explain. Maybe doctors write down the things they know how to treat. Or maybe medicine is waiting for the women to say, "Hello, I'm experiencing the officially approved menopause symptom." Now, Reddit is not a doctor. Let's be clear about that. Reddit has also offered financial advice from people named Crypto Wizard 69. But it still may be showing us what women are not getting enough time to say during a medical appointment. And if something never makes it into the chart, it may never make it into research. And speaking of symptoms no one thought to connect, let's move from brain fog to your teeth. Because apparently menopause is like a meeting with your dentist. Harvard Health reports that menopause may contribute to dry mouth, gum disease, tooth decay, more good news, right? And even shifting teeth. Yes, shifting teeth. Apparently your molars are rethinking their life choices. One reason may be saliva. Estrogen decline can reduce saliva production, and saliva does more than make dental appointments uncomfortable. Oh yeah. It controls bacteria, it neutralizes acids, and it protects your teeth and gums. So when saliva drops, dental problems can arise. Now, menopause is not the only possible cause. Medications matter, illness matters, age, diet, and dental habits matter too. But here's the larger problem. The gynecologist talks about hormones, the primary care doctor talks about bones, and the woman becomes project manager for a healthcare system that refuses to group chat. So tell your dentist you are in perimenopause or menopause. Mention dry mouth, mention gum changes, mention shifting teeth. Because menopause is a whole body experience. It does not stay inside the gynecology department. And that brings us to our final story. Because once researchers stop asking, how do we replace what menopause took away, they can start asking, what does this body need now? Researchers at the University of Colorado are testing a compound called 3F. Quite a creative name, I guess. The idea is to restore vaginal tissue after menopause without exposing the whole body to conventional estrogen. In an animal study, it improved the thickness and structure of the tissue. It also increased protective mucus and restored antimicrobial protein. Promising. But before anyone runs to the pharmacy, this has only been tested, on rats. And rats are famously terrible at filling out patient satisfactory surveys. Doctors call the condition GSM. It's got a bigger name, but I can't say it, so you have to look it up. Sorry. It can involve dryness, fragile tissue, pain, urinary symptoms, recurring infections, and discomfort during sex. Local estrogen can work very well, but it's not right for everyone, including my wife. So this raises an interesting question. Could doctors treat the tissue locally without affecting the whole body? Maybe. We don't know yet. It still needs funding, safety testing, and human trials. Beyond rats. But the direction is encouraging. Instead of saying this body is no longer young, so let's try to make it young again, researchers maybe are asking, what does the body need now? That's a much better question, and frankly, a much less annoying one. These stories all point to the same problem. Menopause has been studied in pieces, symptoms here, a body part there, a rushed appointment at a time. But women do not experience menopause in departments. They experience it as a whole life. I'm a guy, I would know, but this is what I hear from my wife and other women. I really am grateful for what you go through and feel for you. Women experience menopause through their whole body, their whole mind, relationship, workplace, medical system, and apparently a set of teeth, also considering early retirement. Progress begins when medicine listens to the whole story, not just the parts it already knows how to file. I'm Christopher Henze. Thank you for watching Wise Women Forward TV and the news. And remember, the headline is only the beginning of the story. Please like and subscribe. Give us comments. What did you think of these stories? Do you have other story ideas we should cover? Other shows we should make? This is just the beginning for us. So the links to these articles will be in the description below. Thanks for your time.